Before I get started with this, I have to give a shout out to two people. One, I have to give a shout out to Lisa Cabrera because she did a live stream talking about what I'm about to discuss right now, and also to J Dog because he actually tagged me in this article. It's actually two articles I'm going to read, and this one is the first one I'm going to read coming from CNBC, and then I'm going to read another one coming from another source. So basically, as you can see right here on your screen, it says CDC quietly adjusted COVID death data shows higher relative toll on Black and Hispanic people. So, they've always been saying how Black people have a very significantly high death toll rate when it comes to this virus. And of course, they lump Hispanic people in with us. What I've noticed is that, and you may have noticed it too, is they tend to lump us in with Hispanics when there's something negative going on or something negative that can impact us. But when it's not that, or that's not the case, then there's the divide. The great divide comes in. I notice the media likes to do that a lot. But what this video that I'm doing right here is going to show is what one source will say and what another source will say. So this was published on December 4th, 2020. Keep that date in mind going forward. So it says, the Center for Disease Control and Prevention quietly revised its estimates for the disproportionately deadly toll that COVID-19 is taking on communities of color, now reflecting a much higher burden than previously acknowledged. The nation's top health agency revised the analysis after Senator Elizabeth Warren of Massachusetts called on the CDC to adjust the data by age. In a November letter to CDC Director Dr. Robert Redfield, Warren said by failing to adjust COVID-19 mortality rates by age in its public data releases, the CDC may not be providing an accurate assessment of the increased risk of death and serious illness for communities of color relative to white Americans of the same age. After adjusting for age, which is a standard means of measuring disease impact, Hispanic and Black Americans are shown to die at a rate of almost 3 times that of white Americans, the CDC now says. The agency previously said Hispanic and Black Americans were dying at a rate of about 1 and 2 times higher than Caucasians, respectively. The updated analysis also shows that American Indians or Alaska Natives have died at a rate of 2.6 times that of white Americans. The CDC previously put that figure at 1.4 times as high as white Americans. So as you can see, what they're doing right now with this article that I'm reading is they're literally trying to trying to press that narrative, that story, that everybody else suffers more greatly from COVID-19 than palm-colored people, which would explain why palm-colored people's behavior is the way that it is, as they are some of the main ones going around calling this thing a hoax. But we've seen that they can get this just like everybody else, and they have also died from this like every other group. So it's like, what are they trying to say? Are you trying to say just because seemingly you're not dying at the rate as higher as any other group that doesn't affect you? Which is silly to really, when you really think about it, when you digest and break it down. But this is going to flip on its head. The CDC's previous infographic, which downplayed the disproportionate burden on communities of color, was widely shared, including in the agency's framework for equitable allocation of COVID-19 vaccine. The CDC appears to have updated the analysis on November 30th. Representatives for the CDC did not return to CNBC's request for comment. I'm glad the CDC responded to my request and adjusted its official COVID-19 race, ethnicity, mortality rates for age, Warren said in a statement to CNBC. This is a critical update that can help us better understand the true effect of COVID-19 on communities across the nation and begin to address the systemic inequity that exists in our healthcare system. Adjusting for age has such an impact on analysis because people of color are on average significantly younger than non-Hispanic white Americans, as Warren put it in her letter to Redfield. Older people are more likely to die of COVID than younger people. By not adjusting for age, Warren said the CDC did not tell the full story. The fact that the average age among communities of colors is much younger than that of non-Hispanic white Americans makes the disproportionate number of deaths among communities of color of all the more disturbing, she wrote to Redfield. To date, the CDC has not consistently articulated risk and has not provided full and complete information on the degree to which age and race or ethnicity interact to inflate the risk of the virus mortality for communities of color. Dr. Lena Wynn, former Baltimore Health Commissioner, praised Warren and other advocates who pushed for the CDC to make the change. She also applauded the agency for revising the analysis, even if it did come so late into the pandemic. When an emergency room physician and public health professor at George Washington University added that without adjusting for age is like comparing apples to oranges. There are underlying factors in society that are causing a disproportionate impact of people of color, Wynn said Friday. I hope that people will see that it's not the virus that's doing the discriminating. She said in a phone interview, it's our systems. She explained that people of color are more likely to have jobs that deem them essential workers, for example, which increases their risk of exposure to the virus. She also said people of color are more likely to live in multi-generational housing, which could let the virus spread more easily from younger to older people. And black Americans, when said, are more likely to live in food deserts than white Americans, which leads to all kinds of health issues that increase one's vulnerability to the virus. It's important for us to understand why it is that COVID-19 has unveiled and unmasked these underlying disparities, she said. There are short-term things that could be done. For example, targeting testing to areas that are hardest hit, ensuring that resources, including vaccines, are targeted to these same communities, as well as while longer term, committing to working on the social determinants of health. Dr. Thomas Tsai, a surgeon and health policy researcher at Harvard University, applauded the CDC for publishing the new age-adjusted analysis. He said that both the raw analysis and the new one should be published, as both are useful for researchers. Tsai also added that he's concerned that the same disparities that have been evident in the pandemic so far will also be evident in the distribution of a vaccine. We need to make sure that our forecasting models and policy planning models, both for testing as well as vaccine delivery, don't run the danger of perpetuating existing structural inequalities in our healthcare system. He said in a phone interview, you don't want to under-allocate vaccines to black and Hispanic populations. So basically what they're trying to say is that they are messing with these numbers, and it could possibly affect how the vaccine is distributed to us in other non-white communities. Now, I read, as you heard, with this article right here, and they're still saying that black people, and I'm just talking to black people right now, have a very high death toll rate when it comes to this virus. But I'm going to pause this right quick and bring up another article. So here you have this article right here, and this source came from it came from ScienceDaily.com. Now, remember when I told you to pay attention and keep in mind of the dates? This too was published on December 4th, the same exact day as the article I just read from. And it says, once hospitalized, black patients with COVID-19 have a lower risk of death than whites, studies find. The source came from NYU Langone Health, NYU School of Medicine. So now it's getting even more interesting, because at first they're saying that we are very heavily affected. Then they say when hospitalized, we have a lower risk of death than our Caucasian counterparts, saying that they would die more faster or at a higher rate in the hospital than we would. Let's get into it. While multiple research studies show that black and Hispanic patients are more likely to test positive for COVID-19, a team of investigators at NYU Langone Health has found that once hospitalized, black patients, after controlling for other serious health conditions and neighborhood income, were less likely to have severe illness, die, or be discharged to hospice compared to white patients. The study, recently published online in JAMA Network Open, is, according to its authors, one of the first to examine the impact of comorbid conditions and neighborhood socioeconomic status on outcomes for black, Hispanic, and Asian patients hospitalized with COVID-19. Findings indicate that black and Hispanic populations are not inherently more susceptible to poor COVID-19 outcomes compared to other groups, and that once hospitalized, their outcomes are equal to or better than their white counterparts. Now, this is a far cry from what we have heard during the beginning of this pandemic all the way up until now. Because remember when it first happened, like around April, they jumped out and said, oh, we're the ones that are most susceptible to get it. Oh, we're most likely to get it. Oh, we're going to die fast and all that kind of stuff. They came out in droves with that. And Harvey made a good point. When they started to say that, notice a lot of PC individuals started to act even more erratic with the whole mask thing and the quarantine and whatnot. At first they were all for it, but then when they found out, or seemingly so, that it was black people that were more affected by it, oh, let's open everything back up. They're just, they're black, they're disposable. They didn't say that, but that's what they implied. We know that black and Hispanic populations account for a disproportionate share of the COVID-19 related deaths relative to their population size in New York and major cities across the country, says Gabenga Ogedegbe, I probably butchered their name, MD, and PhD, Dr. Adolf and Margaret Berger, Professor of Medicine and Population Health at NYU Langone Health, and the study's lead author. We were, however, surprised to find that black and Hispanic patients were no more likely to be hospitalized across NYU Langone than white patients, which means we need to look at other structural factors at play that are negatively affecting outcomes in these communities. These factors include poor housing conditions, unequal access to health care, differential employment opportunities, and poverty, and they must be addressed, says Ogedegbe, who is also director of NYU Langone's Institute for Excellence in Health Equity. The team of investigators obtained all data from NYU Langone's electronic health record of 9,722 patients tested for COVID-19 at the health system, 260 outpatient office sites, and 4 acute care hospitals in Manhattan, Brooklyn, and Long Island between March 1st, 2020 and April 8th, 2020, and followed them through May 13th, 2020. The patient's race and ethnicity data was self-reported. For every patient who tested positive for COVID-19, the researchers compiled race ethnicity data, patient characteristics such as body mass index or BMI, age and sex, and neighborhood socioeconomic data contained in a weighted index of 7 indicators, including median household income, level of education, and housing value, among others. The studies found among the 4,843 patients who tested positive for COVID-19, 39% were white, 15.7% were black, 25.9% were Hispanic, 7% were Asian, and 7.4% were multiracial or other. 2,623 patients were hospitalized. Of 2,623 patients hospitalized, 39.9% were white, 14.3% were black, 27.3% were Hispanic, 6.9% were Asian, and 7.9% were multiracial or other. Hospitalized patients were older and had higher comorbidity than patients who tested positive but were not hospitalized. 70.8% were discharged, 36.3% experienced critical illness, 24.7% died or were discharged to hospice, and 4.5% remained hospitalized as of May 13, 2020. Black and Hispanic patients had a lower risk of critical illness and were less likely to die or be discharged to hospice compared to white patients. After adjusting for age, sex, insurance status, and comorbidity, black patients continue to have a lower risk of death compared to white patients, while Hispanics and Asians patients had similar rates to white patients. Now, what does that tell you? That 9 times out of 10, they were lying about these numbers. But that should surprise no one. And we know that why they try to make us the face of something that, first off, didn't even, as far as we know, start here. They couldn't put it on the continent. As far as we know, it came from China. But according to this research right here coming out of New York, NYU, we are actually on the better end of it. But what they'll do is they'll keep pumping out the stuff that came out from the previous article I read, or they'll keep putting black faces out there to make it seem like we are suffering the most from this. They're not slick. Our findings provide more evidence that the social determinant of health play a critical role in determining patient outcomes, particularly for black patients, before they ever get to the hospital, said Joseph Ravenel, MD, Associate Professor in the Department of Population Health and Associate Dean for Diversity Affairs and Inclusion at NYU Langone. However, we do see a bit of a paradox. In keeping with other research, we found that once black patients with COVID-19 make it to the hospital, despite coming from lower income neighborhoods, their odds of dying are similar to or lower than white patients. Meanwhile, we also know that black and Hispanic people are disproportionately contracting and dying of COVID-19 across the country. According to Ogedegbe and Ravenel, black populations are more likely to be uninsured and underinsured than white populations, and thus more likely to die at home as opposed to in a hospital due to poor access to care. Another predictor of poor outcomes for patients hospitalized with COVID-19 is male sex. In this particular study cohort, 62% of Black hospitalized patients were female, which could explain their relatively better outcomes. The study population may also not be representative of the overall New York City population. Study senior author Leora Horowitz, MD, associate professor in the Departments of Population Health and Medicine and director for the Center for Healthcare Innovation and Delivery Science at NYU Langone, says that future studies need to better examine the direct impact of structural inequities on racial and ethnic disparities in COVID-19 related hospitalization, morbidity, and mortality. So basically what this article is basically going all the way back to is the fact that Black people don't have access to very good health care, live in very low income and impoverished areas. That's all by design. That's been going on for how long now? So that right there is of no surprise to anybody, which would explain why they keep pumping out there that we are the most susceptible to get this and everything like that. For the most part, a lot of us don't have access to that very good healthcare that our Caucasian counterparts have the luxury of having. See, even with a pandemic, even with a virus, it will still always be race attached to it. That's why I say when it comes to racism and everything like that, that's why it made me so upset when Tamika Mallory had made that statement when she said sexism is about as bad or worse than racism. And then you hear things like this. They find a way to racialize a pandemic. Only in America. It might be other places, but I can only speak for America because that's where I live. So I'm actually leaning more toward this article right here, not because they're saying what they're saying will lean in our favor, but because the media is known to embellish a lot of things when it comes to Black people. And it's amazing they completely jumped out there with that notion that we were majorly affected by this thing when we were only less than a month in. And I'm talking about back in March, and then in April, Black people are the most likely to get it and all types of stuff, almost making it seem like, don't go around them. Shoot, the way that this establishment is set up, we didn't need to have a virus for most to not come around us, unless they wanted to smoke. But I'm gonna leave this one up to y'all. Based on what I read between the two articles, which ones are y'all leaning more towards? Are you leaning more towards the first one, or the first one that basically has been saying the same thing over and over again for the last few months? Or are you more leaning towards this one right here? Now, this is only, as far as I know, attesting more so for those who live in New York. I can't remember if they were saying that this is widespread around the nation, but as far as I know, this is what's happening in New York. So some people might say, okay, this is New York. I need to see what other studies are saying in other major cities that has a big diverse, that's majorly diverse, that has a slightly sizable Black population, to confirm that what they're saying is actually true. But like I said, they can only account for New York. This is not New Jersey. This is not the DMV. This is not California or Florida or Georgia or any other place that has a heavy Black populated area. So I would say that I would like to see also other locations do some studies like they did to determine that. And if more and more start to pop up, then I think we can get some kind of confirmation. But with that being said, I'm going to get off of here. Y'all let me know what y'all think down in the comments. Like, share, subscribe, and I'll talk to you in the next one.